Hi everyone, my name is Dr. Tiv. Now, I'm teaching the Power Up series right now, but that doesn't mean I can't be here giving you some information about clinical and communication efficiencies with dental assistants. Now, our dental assistants are the humble heroes of our dental practice. And because time is very important to us, the more we can utilize them to help communicate with the patients and to help our clinical efficiencies, the happier we will be, and you know what? The happier they'll be as well. So I'm going to show you a quick video right now. If you have a look right there. Now, take a guess at how long that dental assistant has been a dental assistant. Just take a guess, a wild guess. Would it surprise you to know that Ella over there in this video has only been a dental assistant for 3 days? 3 days, no prior training, no prior knowledge, no certificates in dental anything. Now, let me show you a quick clip with Tori as well. Now, Tori's been with us for almost 4 years now. With a lot of training and a lot of effort, we were able to get her to being pretty much a head dental nurse at the clinic, which is amazing. She's super proud of that as well. I've recorded a few recordings of me practicing with my dental assistant, and I want to walk you through some of the steps that they do and what they're trying to achieve, in case you don't know what this kind of works like. This is what I call four-handed dentistry. I wrote an article with the ADA about it a few years back, and I'm super passionate about it. Because basically for me, what I want to do is I want to be able to sit there and do the work that only I'm legally allowed to do by APRA, and let the DAs handle everything else so I can be as efficient as possible. Because guess what? No matter how good you are, your patients hate being in the dental chair. So the least amount of time they can be there, the happier they'll be and the happier you'll be as well. So let me jump to some videos and let me show you what's going on. So the first thing you'll notice is that Tori is taking an intraoral scan. It's non-invasive, there's nothing irreversible about it. Intraoral scanner pretty much takes photos and uses photogrammetry to make a 3D model. So it's something that's well within the capabilities of a well-trained DA. Now, Tori's really good at this, and it's because she's quite alert as well. Now, the other thing that you might notice is that the DAs stand when they're nursing. We don't tell them to, but it's for two reasons. One is so they can see above and see what's happening, and secondly, they don't need to twist their back. They actually pivot around their legs, like playing netball almost. Now, the other thing you'll notice is that Tori has her triplex most of the time, and she's helping me. She's attentive and seeing what's happening in the tooth. Long gone are the days where the dental assistant is falling asleep and staring up at the ceiling. You can see that she's attentive the whole time because she's part of the whole process. And I think there's some value for a DA to be part of the whole process, give some purpose and meaning. And I must say that pretty much every patient at the end of the appointment not only thanks me, but thanks the DA as well, because they can see they're an integral part of the whole procedure. Now, Tori's at the moment is drying up or is blowing off all the aerobrasion particles and is washing the tooth as well, so I can take a really good look at it. Now, she'll be giving me the etch. Again, I can just focus on the field and she'll be right there ready for me. So microbrush is right in hand, and she'll get the suction and pass me my triplex, so I don't really need to look away at any point or time. Nice. So this is a multicam view, so I've got a camera on my forehead, one on the light, which I never use because I've got loops, and there's the one of the wide angle of Tori and I as well. So there's a few things that we've taught the nurses. One is that I can only see during the loops where the light is, so they'll bring everything to that light. And again, you can see Tori here helping me wash and dry as well, taking good care. You can see how she's looking around to see what's happening. Now you can see her fingers right in the light because I can't see past it, so she knows that if she wants me to know that she's there, she has to put her finger in the light. Now she's testing the triplex to make sure it's not going to fall out, so that's horrible. But I will do something which is trust but verify. I know she's done it, but I'm going to verify it again for the first time, because if you don't, and it falls off, it can be quite a projectile, and we don't want that. So Tori's coming in now and she's helping me wash and dry as well. You'll notice she'll wash and dry her own suction because there might be contaminants on that too, which we don't want around. She's having a really good look. And she's my second set of eyes and brain as well. She'll let me know if there's any etch around or if there's something that I missed. But she's got a different perspective. She can come in and have a look at it and be like, Dr. Tiv, have a look at this. What do you reckon? And she's passing me some cavity conditioner, and again her fingers are right in the light there so that I can see that she's waiting there for me. Now she's got another cotton pellet there for me, and it's right there in my light so that through my loops, that's all I can see. I know she's right there for me. And again, you can see there's no real twisting in their back because they're actually pivoting around with their legs. We tend to find that there's less injuries with the DAs, and they get the strength in their legs at the same time. For longer procedures, they do sit down if they don't have to twist around, but when there's twisting and turning, which is pretty much most of the restorative processes, they prefer to stand because they can reach over and grab these suctions, hand pieces, triplexes, whatever they need to with quite ease. You're going to see Tori grab my handpiece. She's already put a bear in place for me while I was doing something else, and I'm ready to go. There's no mucking around. The handpiece is right there in my hands, and you can see there's so little wasted time. So the patient can get out of there as soon as possible. And we know how little patients like being in a dental chair, so the more efficient we are, the better it is for us. And the patients comment too, saying, like, it's amazing how efficient you two are. It's like, you know, you guys are like a well-oiled machine, and we love hearing that. All right, so that video was really cool. Now I'm going to head back to Ella's video again, and I'm going to show you how I do the training process. So again, remember, Ella's 3 days in, and you'll hear me, now the audio is not great, but you'll hear me say things to Ella and how I educate her into what to do next so that she can start learning to be a really efficient and functional DA from day 3 onwards. Okay, let's grab the edge, please. Give me a microbrush for the edge. So I'll be giving them comments on what to get. What are we going to do after this? So there's mini tests. I'll be asking them, what would you get after this? What are we doing next? So that way they can bed in information we've taught them. And you've noticed I've asked them, can you give me the suction? I'm telling them now, switch hands, move to the other hand. Put that one down. Giving them step-by-step instructions of what I want them to do. And again. Run the cavity cleanse on the fingers. And that. Excellent. We need the dry cotton pelts. So it's really important that we know what we want so we can ask the DA for what we want and train them exactly how we'd like to operate. The worst mistake for us is not knowing what we want and just kind of abdicating responsibility. So just saying to the DA, you should know what I want, because all dentists are different. So it's very hard for them to know what you want unless you actually tell them. And you can see there, at this stage, I'm still looking over and verifying everything that she's doing. Because, like I was saying, trust but verify. I trust that she's got it, but I'm going to verify it to make sure it's absolutely correct. Because, as far as I'm concerned, the patient shouldn't have to suffer for an inexperienced DA. It's my responsibility. I can delegate, but at the end of the day, when push comes to shove, it's my responsibility. So giving an encouragement, I'm saying that's beautiful, that's lovely.
because you got to admit, for 3 days, it's pretty good.
You can read it, the timer. Yeah, you can take the press now. You're going to want the bathroom dish again. Grab the bathroom dish. Perfect. You can ask me if you want some more, if you're not sure what to do. No, I'm good, thank you. I'm going to dry this one more time.
I even go to the point of asking them to ask me what I want them to ask me. So I'll say, you should ask me if I need more bond, and they'll ask me, do you need more bond? And I'll say, no, I don't. So I always find that a bit hilarious. But you need to get to that depth of specificity of telling them what you want them to ask you at different parts of the process. Again, you can see the little fingers out trying to get into my light to show me that I'm there. She hasn't quite got it yet, but it's pretty close.
Put yourself down. Add some more bond, so bring the whole bathroom dish again. Yeah, you can put that down. We're going to cure everything up.
Look, now if you guys want to get in contact with me, there's a few ways to do that. The first one is on Instagram at dr.tiv, so dr.tiv. I'm not on that all that much, but you can try it there. Facebook is probably the best way to get to me. Now, there's a Facebook forum that I run called DLC, Dental Learning Center. Yes, I'm a nerd and I know what DLC means in computer terms, but that's exactly why I picked the title. It's downloadable content to our brains. So in DLC, it's different from other forums. It's a safe place. It's a safe place where you can ask any question you want, and there's no bullies allowed, no people sneering at you and saying that's a stupid question. And the whole point of this place is to be supportive of each other and of other people. And if you want to join, look up DLC, Dental Learning Center, on the Facebook forum groups, and then join up. Hope to see you there, and if you're there, you can contact me, ask me questions, and we'll answer it in any way we can. This is Dr. Tiv, over and out.